doing Melissa, what I've noticed previously in this, she has a little bit of lip asymmetry. She's got a little more fullness, a little smoother on this side, a little bit deficiency there, and her whole lip curves up just a little bit more on this side. So I'm going to try to add, about the only thing that I'm doing a little bit different on her is adding a little bit of volume in the lower part here to try to smooth that out just a little bit. She already has a pretty well defined white roll, which we talked about earlier, and a good cupid's bow. What she needs is really more just volume in the red. So in the lower lip, typically for most people, what is generally considered aesthetically ideal, and not that there's necessarily an ideal, but most people, their lower lip has about twice as much red show as their upper lip. And if you see people who've had their lips done and done poorly, a lot of times what happens is they'll emphasize the upper lip, because I think that's what people think, oh, I've got a lip, the upper lip I think draws more attention because there's more definition to it. And they end up getting overfilled in their upper lip, and then they don't look natural at all. You know, the lower lip should have more volume than the lower. So most of the time when I'm doing this, I end up trying to add just about the same amount of volume to the upper and the lower lip so that the ratio stays the same. I'm using Velour, which is most similar to Juvederm, but it's sort of a new, it's their latest incarnation of a hyaluronic acid filler, and it generally injects just a little bit smoother, I've found, and a little easier when you're pushing, so you have to be careful, or it's pretty easy to get a little too much very quickly. Okay, not much.
I think Terry's a little tougher than I am.
I saw a little jump there.
Just a little. Not bad.
You're not anticipating pain, are you?
Just the thought of it.
This is the first time in almost 70 years that I've ever seen anyone get a shot.
Oh, wow.
Yeah.
I was turning my head.
Congratulations.
I haven't fainted.
What a first one.
I think that I've come pretty close to accomplishing what I was trying to do, which adding just a little bit of volume and trying to get that what I perceive as a little bit of asymmetry. On the other side, I'll probably use just a little bit less, and then I think she'll come out more symmetrical. And I'll give her a mirror to look and see what she thinks.
Oh, good. Good.
Better?
Mm-hmm.
All right.
And how much have you put in?
I have put in almost 0.2 cc's. So if you can tilt your head back a little bit more. Good. When it comes to lip, more is not better, for certain. And I think one of the tricks of doing lips is that you can't make someone with relatively fine lips have really plump full lips by adding a bunch of extra filler. All you do is make them stick out and look very unnatural. The converse of that is if you have someone who already has naturally full lips, you can put a lot of filler in and it will still look pretty natural.
Nice.
The other side is already swollen a little bit relative to this one, but it looks pretty even. But almost the same, a little bit less on this side. Look.
No,
Shape
I
looks
trust
great.
you.
So one of the things that, and this is a relatively new trick for me, I guess I learned it about a year ago, 6 months or so ago, is to get the red to roll out, almost a little pillar going back and forth this way, which I inject from the inside out, and it really tends to turn that red out, and I think it looks nice without adding a bunch of extra volume to the lip. Lower lip. I don't know if you all noticed, before I started on the lower lip, you can tell she's almost at a 1-to-1 ratio upper and lower lip, and I think it looks a little bit unnatural right now. And when I get a little bit of volume in the lower lip, that will even back out. Fortunately, this stuff is fairly moldable early on, so if you see a little lump or a bump, it's pretty easy to smooth it back out.
Like when I'm in so long I can't talk and mouth is together. Right?
Close. Not tight. There you go.
What to get for saying I didn't. What to get for saying I didn't.
It hasn't been bad on any of them, though. I think that looks pretty even. Anything you see that I need to correct a little bit of?
Teeny bit right there.
I agree. A little bit there, and then I'm going to have some extra to put in the commissure. Yep. All right. Better. All right. Keep it all close. That side turned up.
Downturn.
Yeah, I don't know. Before I do this side, see if you all can see the difference in those two sides. You can see how this side, it doesn't completely pop out like you might think I want, but you get a little bit of upturn and just a little bit of extra support that helps the corner stay up a little bit. Again, one of those things where a little bit's better, too much is looks jokerish or looks chipmunky. So
Lips look great.
I have a little bit of an advantage with Melissa. I've done her injection before, so I know what works and what doesn't work on her. I think that looks pretty even.
Oh, much better.
So, again, for her, I think she had a well-defined white roll, so I wasn't worried about really defining her lip a whole lot, as much as I was just adding a little bit extra volume. I think, you know, everybody's lips are a little bit different, so there's no one size fits all, and you just see what you think, you know, between the patient and myself, trying to figure out this is what I think will give you what you're looking for.
And what your goals are.
And sometimes that's, you know, in her case, I think velour was a great choice. Sometimes Velbella is a little better choice for defining the roles. I think Juvederm and velour are pretty interchangeable. I'm excited about velour because it makes my job easier, but I'm not sure that it works any better. It's just easier.
Well, I don't guess any of these young girls are going to ask, but are these lips still kissable?
Yes. They will be firm to touch for maybe 2 or 3 days typically, and then I hear people say they don't really notice it so much. And you'll be a little numb for an hour, so maybe not be on your best form.
But you won't be drooling on yourself.